Hello, my name is Dr. Mila Senem Levison. I'm a consultant in general adult psychiatry in London. So I would like to talk about ADHD, particularly the presentation of ADHD in women. So ADHD is the acronym for Attention Deficit Hyperactivity Disorder, and approximately we see it in 1 in 25 adults. The main characteristics of ADHD are inattention, so that's difficulty maintaining one's attention and focus, concentration, getting distracted. Another component is hyperactivity, which often manifests as fidgeting and not being able to really sit still or always needing to be moving around, feeling restless. And lastly, the other main component is impulsivity. So this can manifest as getting really impatient in traffic or not wanting to wait in queues, interrupting others, completing someone else's sentences, or giving the answer before the question is completed. Often, ADHD is diagnosed in childhood, but more and more we see that ADHD is not noticed until one is older in life. A key time that we see the presentation of ADHD in adults is when the person leaves the home environment where they have been attending school that has a structure, when they have the support of their family, to when they actually say start university, when they're on their own for the first time. So, and they have lost that structure of the school, and suddenly they have to be organizing their time, attending lectures. So that's normally when one can get quite overwhelmed, and then the ADHD presentation can be much more visible and start to cause difficulties for the person. And often in women, the presentation of ADHD, when it comes to the attention of the mental health professionals, is when they're older. And that's because generally, and I mean, this doesn't mean this is for certain, but generally in children, in boys, it does manifest more as hyperactivity and impulsivity, whereas with girls, they tend to be more quiet, more prone to daydreaming, so it's not noticed as much and that's picked on. Well, obviously, this is a sort of a generalization, and it can show itself in different ways in different people. I would like to talk about now how ADHD can then be diagnosed. So it would be people like myself, sometimes the psychologists, but after a referral, it's really important to see the person, talk about their health, talk about their mental well-being, and then be able to see whether this is genuinely ADHD or whether the difficulties are actually caused by different things, but not ADHD. So it could be like a traumatic upbringing, adverse events in childhood, stress, depression, anxiety. Once the diagnosis of ADHD is made, there are then different ways of managing it, and often we try to build a holistic picture and support the individual based on their needs. So if I can give a bit of information about how ADHD is treated, most people know about medication or think about medication, and indeed medication is a recommended approach, and many people find medication helpful in terms of helping with their focus, attention, reducing procrastination, feeling more motivated. But it doesn't suit everybody, and it is medication that we need to monitor very closely. Outside of medication, there are also many ways that an individual can help themselves if they have ADHD. So this could be through many ways. So often people develop multiple ways to support themselves. One thing I would definitely recommend is trying to have a balanced diet. So, not too much sugar, not too much caffeine, not too much alcohol. And this will all help to maintain a more stable mental health and not have too many fluctuations, whether that's in your blood sugar or energy levels. Another thing to focus on, and forgive the pun, but and if you can manage, and I'm aware that many people do have difficulty with this, and having ADHD is also another risk factor why sleep might be difficult, but it is important to focus on sleep and try to get as much sleep as possible to feel rested. Um, Outside of that, exercise is really important, and there are lots of studies showing that exercise is really helpful to maintain one's mental health, but also really helps with ADHD. So if this is something that you can do, I think that's definitely you can try to do that regularly. And it can be anything that you enjoy. It could be something that has high intensity, or it could be something that's more resistance based, but something that can help strengthen your body, and which can also then start to have benefits for your mind. Other ways to manage things could be ensuring that there's structure to your day, and that might be using multiple systems like an agenda, phone calendar, color coding different requirements of the day, and so that it's written down and you don't have to carry it in your mind. You can also help to break tasks into what's urgent and what can wait a little bit more, and so that you can then plan your day as much as you can, and that can also reduce the overwhelm that one has. Another way that one can do to help manage their ADHD is, again, just having small things in your life that can help you. So maybe putting tags on your belongings, ensuring that you have a set place for your keys and phone. So when you come home, for example, they're all there. So you don't have to think about where you left them and spend a lot of time looking for them. So a lot of these things are actually quite simple and straightforward, but over time they help to make good habits and then help one manage their ADHD better. Alongside this, having psychological therapy, and that can often also be helpful because things like anxiety and mood problems often coexist, or impulse control, anger management, low frustration tolerance is usually very commonly seen in ADHD. So working with a good psychologist or therapist can really help with that. And sometimes people choose good ADHD coaches to perhaps help manage more of the practicalities in their lives, and that's also something that can be helpful. And it's important to monitor your health, and if you're on medication, monitoring your blood pressure and your heart rate. But these are things that you will need to talk to your doctor about.